Ladies and gentlemen, very special guest tonight. The overworked and underslept Paul Cottrell from the state of New York is joining us live, and you can see his ugly mug there. Tonight we're going to be talking about a couple of things that are very important, and none of them involve the military in Germany, which he cannot see. But I'm going to now share the screen with Paul, so he's with us on the program. Paul Cottrell, happy to have you on the program. How are you doing, Mr. Underslept?
I'm doing all right. I'm doing all right.
Now you've been doing
Thanks for having me.
tons of shows. You're all over the place. You're on Evolutionary Energy Arts. You're on like some low budget channel of Jesus gun toting.
Locked and loaded. Yeah,
locked and loaded. I mean, you're everywhere. And
yeah,
and,
I was
go ahead,
on Locked and Loaded.
It.
Yeah, and then I'm also doing Doug. So today I was on Evolutionary Energy Arts, and Locked and Loaded, 100%. And on Monday I'm scheduled to be on Doug Hagman.
Who's Doug Hagman? And
on Monday, I have to verify that with my hand.
Who is Doug Hagman?
But yeah, I'll be on Doug Hagman's show on Monday.
Did you hear that? Who's Doug Hagman?
Hello?
Yeah,
Can't hear you.
Who's Doug Hagman and why should we care? Oh, I'm on mute. I'm sorry. I'm trying to unmute myself.
Okay, I can hear you.
Can you hear me now?
Yeah, I can hear you.
Who's this guy? Whose show are you going on? Hal Hagman or whatever? Who is that guy?
Oh, Doug Hagman. He's an investigative reporter. I think he's more kind of like I think his background's more like detective type stuff. But he has his own show. He's been around for a while. He's kind of connected with Alex Jones, and I think the next step after that will be the Alex Jones show.
Oh, okay. So he seems.
He actually sits in for Alex Jones. He sits in for Alex Jones when Alex Jones is on vacation. But he has his own show, and I'll be on his show, on the Doug Hagman show.
Okay, well, good luck there. Let's talk about this coming out here. Can you see the screen share I'm giving you?
Yes.
North Korea clearly lying about coronavirus cases, expert says. Now, I looked into this 48 hours ago, which for us is like a decade. 2 days ago is forever. And when I was seeing North Korea reporting 2 cases and their connection to China and the people that are coming in and out of there, I did not believe this one at all. And I did not read this article. And you're up to date. So what have you learned about North Korea and what can you tell us?
Well, North Korea, I don't know about. I do know about what happened in Japan just a few hours ago, and that was another death. Outside of China, or 3. Thank you.
Yeah, so we officially have a death. Is it somebody from the cruise? Do you know? And can you get back into the center of your video?
No, it's a feed.
You're off the video. There you go.
Yeah, there's a little bit of delay. There. Sorry. All right. So that woman that died, I believe, was 80 years old, and she's tied.
Yeah, she was 80.
Driver.
She was 80, and she was tied to that cab driver who could be a super spreader, right? So he could have spread it to God knows how many people.
Right. Exactly. And this is the point that we've been making 2 days ago about. It could live on surfaces for 9 days, and the incubations can be as long as 24 days. You can see in the data that there is a breakout starting in Japan, in Singapore. It has now a lockdown for 10,000 people. And, we've already heard the lockdown of Shenzhen in China, which is another large large area of China, much larger than Wuhan. And we have another case in 15 in the United States. So, one breakout today, Thursday of this week, in the United States and in Canada. And luckily, we have not seen those seed centers producing 10 new cases, but it seems as though it's about ready to start. And those cases, those test kits, I believe, are delivered today to those local locations, the local municipalities, for testing instead of just testing at the CDC. So once
Paul, your connection is terrible.
Nations of Wuhan.
So let me jump in here and let's talk about the graph that you can probably see here. This is the Johns Hopkins graph, and it has two data points, one from yesterday and another one from midday today. And it shows a 33 and a 40% jump in cases confirmed. Now, and this jump was based on a new way of reporting on COVID-19. And so instead of using the test kits, what they're doing is they're taking chest x-rays. I'm sure you're aware. And if you are pneumatic, meaning there's a massive change from one day to the next where there's fluid in the lungs, you immediately go onto the COVID-19 spectrum without the test. And I believe that this is probably 90% accurate because the amount of pneumonia cases are so low in this region on a daily basis that they can actually be reporting on this more accurately. Now, based on this jump in the new way of analyzing COVID-19 cases, do you have any insight into what this graph actually should look like and how it should play out in the future?
Well, it's going to be growing. I listened to the part of the WHO conference that discusses the jump in the numbers, and my gut feeling is that it's cover. It's cover for a larger number that's going to come out, and they're trying to give this. They're trying to give saving face to the Chinese because the WHO realizes that the Chinese is lying about the numbers. Not only that, I've been saying for about a week and a half that you got to treat this early, independent of if you have already confirmed the Wuhan positive test, and start, administering these protease inhibitors. So the WHO is kind of proving my point by saying you don't have to necessarily have the confirmation. All you have to do is look at the clinical findings that are in the X-ray and err on the side of caution, assume that it's Wuhan. Why, if there's an outbreak and everyone seems to have the same clinical presentation, you just assume that you have you go old school. Doctors before they had molecular biology testing,
but
would treat it, based on
Paul,
and they're going back to old school.
Yeah, it's a day late and a dollar short. We're working on capitalism.
Right.
People have limited number of resources, right? We only have 89 of these tests, and we have 800,000 people that have the symptoms. What do? So they do nothing. They use the test. They give us faulty numbers, and then they decide clinically. Now, albeit it's like 20 days from the outbreak.
What's really
Listen
interesting.
Listen to this. This is what I think is interesting. 20 days from the official outbreak, they finally decide that an X-ray that shows pneumonia is effective. Why did they wait 24 days when the gestation is 24 days? In my opinion, this is on purpose to get a maximum count to actually see what the virus does to the population so that they can make more logistical determinations how they want to move forward, in my opinion.
It's possible. I mean, what you're saying is very possible. It's sinister, but it's possible. I just find it odd that when you look at that chart, right when the curve was starting to where if you look at the first derivative, that right at that point it would have been zero. That first derivative would have been zero. So that means, no growth. And then all of a sudden they give you a big number. So I just find that interesting. Yeah, I just find that interesting that
that's a
why
boom.
didn't they release the big number while you still had a positive derivative?
Now here,
First derivative.
I just
So,
jumped. I jumped to the Wu-flu graphs, and these are not updated with the second data point that John Hopkins has. These are yesterday's data still, but we're here at Wu-flu, and you can see how ridiculous this new number looks when you go to global infection rates per day. And then, and if we go to more graphs, there's a more telling graph here, the global infection acceleration rate. If this is the new true number, the acceleration rate from the old number is bogus. So I don't want people to get their panties in a bunch here. You're going from a bogus data set to a real data set. So this acceleration in infection is not happening. But what is happening
I'd like to give it.
What is happening is that this is the actual infection rate, that around 13,000 per day is actually the infection rate based on this number. What are your thoughts?
Based on I agree with you that people are going to freak out because they're looking at the whole data set that was released. And they don't realize that when you work with data sets, if they're not sampled with the same methodology for each data point, there is some bias in the data. And unfortunately the last 10 days or whatever have been scant data, not collected with the same methodologies, and you can't truly create a true acceleration curve. You don't really fully understand that, the true acceleration. Now, just to add to what you're saying, I don't even believe that the new data release is accurate, because again, the crematoriums would not be running 24/7 if you had such a low death rate in Wuhan.
Right. So let's
from what is being reported. I think the death. Yeah, go ahead.
Let me break it down for the layman, Paul, and listen to me and correct me if I'm wrong. So I'm going to break it down for the layman, because that's who's watching the show. This spike is incorrect. This is a readjustment of the data. So basically, if we're looking at the top right here on infections per day, which is an understatement, it is the current most correct statement from the official sources. And in my opinion, this number at 15,000 in a single day is probably low. It's only the people that are actually being tested by officials. And so the rest of the data past 12/11 is flawed. And you can see here starting at 2/4. Paul, can you follow me down here on the graph? At 2/4.
Yeah, I'm looking.
Till present, the down drop was based on the fact, and I know this based on my investigations, that they had no more testing strips. So they couldn't actually test people for this coronavirus. Starting on the 4th of February, they were really limited in their testing. So the numbers began to drop, but that was not the true case. The true case, if you look over in the purple to the left, here, infections going up, that is the graph you want to look at. And you can superimpose this purple right on top of the yellow. Just connect this top dot with the bottom dot, and you'll get a more adjusted reality, just a straight line going up. So the reality is that with the new type of, development of identifying the COVID-19 virus, we have a spike. But this spike is still underplaying the actual amount of infections per day. And not only that, based on the information that Paul and I have been gathering for 48 to 72 hours, and that's been coming out on some cutting-edge news channels that we've been reporting on, there are over 40 crematoriums that are working at maximum power. They cannot keep up with the staff. They've asked for 50 or more cars per crematorium. The people have been working 24 hours a day, which means that they could be potentially disposing of up to 1,400 to 3,000 bodies daily for the last 3,000 days, which means there are 9,000 to 10,000 deaths in Wuhan area, which is
Right.
about 7,500 above normal, which is not the deaths being reported. So either there's 10,000 dead and we're being lied to, or the people in Wuhan actually working there are lying to us, or everyone is lying to us, or the officials are lying to us. What is your take, Paul?
I think the deaths are actually higher. I think it's closer to what Guo was saying, that it's closer to 50,000. It's unfortunately they're not willing to share. China has the population that's related to this virus, and they're not sharing the data in a timely manner and in an accurate manner. So we really don't know. We don't really know. We really don't know the true situation. So. But the data that's in the United States and in Canada, I believe. I don't think the developed nations are lying. So that's a good, these overall data sets, some of it is very accurate, but the bulk of the data set, which is coming from China, is very inaccurate, which is skewing everything. That's why I keep on saying, watch for the seed centers in the United States. It's really, really important to see what the true outbreaks happen in these developed nations.
Yeah. Also, more important, Paul,
and Japan.
More important, Paul, is the investigative journalists like my partner Leah Shaper and others that are going out and on their own and delving into the contact idea. And what we've uncovered here at the Oppenheimer Ranch is that Hong Kong is the next time bomb, because people in Hong Kong that are currently infected were treated improperly, reintegrated into society after they had touched thousands of people. And based on improper protocols in Hong Kong, we believe that that's the next outbreak. Additionally, we have hundreds of people currently under quarantine. We know about the gestation period could be up to 24 days, and even up to 15% of people with this type of coronavirus may be asymptomatic for the entire time. There are people that could never show symptoms that could shed this disease and be infecting people because it's a coronavirus. It's the cold, for goodness sakes. There are definitely going to be cases where people don't get sick and they get dozens of people sick. We've already reported on it. There's one super spreader that definitely has gotten 11 people sick and maybe more. What are your thoughts on super spreader and the fact that this is not over?
Oh, that's the point that I've been making is that these super spreaders are going to create these seed centers, and you're going to see in the data big blip ups, in tens. It'll be first, 10 cases, and then 20 cases, and then 50 cases, and then 100 cases. So, but there's a lag. The people are already infected. It's just not showing up because they are asymptomatic. And I think that I think it's very highly probable that the outbreaks are going to start in California, because there is 4 locations now, and it seems to be a little bit more. It seems to be a little bit more concentrated in terms of the United States. This Wuhan virus seems to be more concentrated in terms of confirmed cases, California, than any other state. So I think just through probability that we're going to see one of the seed centers in California to be the true outbreak center in the United States, and maybe outside of Vancouver, for Canada. But my eye is on the United States and Canada now. It's starting, and those test kits are just getting to those local places. So we could, the medical establishment could know that individuals are sick and possibly with coronavirus, but aren't willing to actually confirm it because they haven't tested it with the
Right.
new kits.
Now
But there
here,
was an article on
oh, God.
CNN. There was an article on CNN that were stating that these test kits actually, there's some question about the actual accuracy of these things, and
Yeah,
we've been
listen,
stating this for a
Paul,
while.
Paul.
On that
The efficacy today has been challenged. In fact, the test kits that were sent to multiple states in the U.S. are all false. They're incorrect. In fact, they're less than 40% accurate. So every single test kit, the ones that were sent to
Mhm.
San Diego, the ones that were sent to Texas, the ones that were sent to where all the quarantines were, they are they're bad. They're 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 flawed. They're 40% or less accurate, and they're recalling them. So, and that means that all the people
Right.
that have been adjudicated through this process are 60% of them could be infected, which is completely insane. So the test kit. Now, this is another
Right.
ball the World Health Organization has dropped. So the World Health Organization, let's go over it. First of all, told everybody they can't get this virus from touching people. Everything's safe. We should not stop commerce. We should not stop travel. Everything is safe and blah, blah, blah. And oh, yeah. And then we're going to jump the cases 33% overnight because we found a new way to diagnose it, which took 2 weeks to figure out. These people at the WHO are incompetent. They are not physicians. I have more credentials than anyone at the WHO to pre-diagnose this condition and to treat it, in my opinion, than anyone on the fucking planet, and you as well. And yet these frauds are in control of our society and the commerce. There are millions, billions of people, and we should trust these schmucks. I mean, I am so pissed that we should trust these schmucks. What are your words? Schmucks. They're schmucks.
I agree with I agree with you. I absolutely agree with you. Um, I- the WHO is now priming us to accept the fact that they're going to have to start treating people based on clinical presentation and not through test verification. They're going to run out of kits, even if they don't work. And once people, start seeing this pneumonia or deep respiratory issue, you're going to have to just assume that it is Wuhan. Well, and what I really want to know from our what 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 I really would like to know, by the NIH and the CDC is, do we have enough medication, antiviral medication in our country? What is the stock? And when would we be resupplied? And this is something that I have not seen a reporter ask.
You know
Now,
why?
they could have asked and they've answered it, but I think there is a serious supply issue when it comes to these antiviral medications.
You want to know why?
Well, they don't want to scare the public, to tell them that we're in a crisis with just the actual medical supplies that we need.
Look, Paul, back in 2014, and we have the paper up, the Center for Arms Control and Nonproliferation in Washington, D.C., Science and Medication Journalism, Walter Cronkite School of Journalism, Mass Communication, Arizona State, they teamed up and they did a geopolitical survey on the consequences of lab escape of a potential pandemic pathogen. Now, this is the time in which billions of dollars were being spent by the U.S. government and others to develop biological weapons worldwide. And this is a very big issue. So just a few years ago, we were wondering what the big issue could be with spending billions of dollars on a biological weapons program. And that's the consequences of a lab escape of a potential pandemic pathogen. And according to many, this has occurred several times in the last few years. Now, luckily, these pandemic pathogens have been quarantined, like the SARS or maybe Ebola. Even AIDS has been considered to be one of these genetically manipulated pathogens. And now we're getting better at it with CRISPR. So we're so good at developing viruses that we can develop a virus that we could have a fail stop to, or could kill itself out, or there's some way that the powers that be that could potentially inflict this virus on the public would be protected. And ironically, there's a lab in California that just said that within 3 hours, using supercomputers, it was able to decoct a vaccine for the COVID-19. And this is coming from a vaccine lab funded by Bill and Melinda Gates in California, of all things. Now, a lot of people are starting conspiracy theories based on the fact that Bill and Melinda Gates have their foothold in vaccines, but they've basically developed the entire worldwide vaccine program over the last 10 decades with their billions of extra dollars. So it's not a conspiracy to me to think that they have their teats into this program, but it is conspiratorial to think that someone could come up with a vaccine in 3 hours. What are your thoughts?
Well, there is a lot of data when you look at during the nuclear testing age of the United States, where they did nefarious things to understand radiation exposure to a population. And, they didn't admit to it until later, what the actual operations were.
Duh.
So it wouldn't surprise me that they're actually doing a test of, biological pathogens that were bioengineered to see how the population reacts to it, just based on how they handled nuclear weapons, back in the 40s and the 50s when they did this testing.
You have to bomb people to understand how it affects the population. So that's what you do.
Right. So they may be actually doing this for biological research to how to handle it if there was actually a biowar between countries. Just because there's a treaty doesn't mean that countries won't use.
So let's flip the switch.
But if we go down that rabbit hole, then the U.S. government is complicit on killing its own citizens.
Well,
based on
Paul, we know
bio research.
Yeah, we know that rabbit hole exists, and let's talk about solutions. We've been 30 minutes deep now talking about the nefarious potential of this virus, the fact that the WHO is complicit and absolutely completely useless in actually protecting the population. The World Health Organization has been complimenting communist China since the beginning of this outbreak on how awesome they are. And then yesterday, the number of confirmed cases jumps 33%. Apparently because the World Health Organization was shut out to such a degree that they could not even be a factor in the numbers that were coming out of that region. So that alone should allow people to understand that the World Health Organization. Someone else is Skyping you. Man, you're a popular guy. I want to talk about solutions. So get on with what you're saying, and let's talk about some solutions.
Here's my theory about the WHO and what you said, because China is such a big manufacturer of the pharmaceuticals that we need, not just in this particular case with vaccinations and ACE protease inhibitors, but also other medications. That if the World Health Organization doesn't kowtow to China, then we may not get those medications from their manufacturing facilities. So we're almost have to placate to them and not really reveal the things that have been going on in Wuhan, so we can get medicines. And this goes back to the whole concept of localization versus globalization. With localization, you're not as fragile when there is these pandemics. So there are a couple reasons. There are a couple reasons why I think the WHO seems to be complicit in hiding numbers and putting China in this on a pedestal, saying that, they've done so great, for the world community and how they're dealing with this particular outbreak. There are a multitude of things that are going on there, but I think a big part of it is that they have the medicines that our country needs. And I want the CDC and the NIH to tell the American public that we have a crisis on our hands when it comes to the supply, the actual pharmaceutical supply. This is a major problem, and I'm surprised that no one brings it up.
Well, I'm not surprised, Paul, but you and I are about to go through some esoteric information, and we're going to inform the public, because you froze up, on the Thieves Blend since 1413. Now, the Thieves Blend, have you heard of it?
Well, some of this, I don't know. No, I haven't heard the term, but
Okay, well then
okay,
stop
so go
talking,
ahead.
because you're in Harvard Medical School,
Right.
and you're not going to ever get taught any of this information.
Right.
The
All right.
Thieves Oil Blend sells for up to $80 a half an ounce. The Thieves Oil Blend comes from historical documentation during the plague. The Thieves Oil Blend since 1413 is what ended the plague. And let me tell you what happened. There was a group of thieves. When the plague broke out, just like now, the Wuhan virus, a group of individuals that were importers on the coast of spices and herbs were put out of business because all of manufacturing shut down and all of the shipping shut down during the plague. Mm-hmm. And when that shut down, these people had no work. They had no, and they're covered in these essential oils and herbs. And so they move inland where the plague is, and they find people dying by the millions. And while they go from homestead to homestead, there's no one alive. So they're in these homesteads where everyone's dead from the plague, and they have all this shit there. So they take all their stuff. They take their gold, their money, whatever they can trade as they move forward. Because this is 1400. Can you imagine? You're moving thousands of miles one way, and you're like hunter-gatherer society mentality. So you're moving inland, and you're going from one dead community to the next, and you're taking stuff of value because anyone else who comes in there is going to take it, correct? But yet you get charged with robbery and thievery, etc. Because the plague broke out, and they didn't know what was happening. They were burning witches at the stake. And so finally the thieves get caught. After they have stolen millions of dollars from the dead people, they're not dead. Everyone else is dead. Anyone who deals with the plague, people are dead, but these thieves are not dead. Are you picking up what I'm putting down?
Mm-hmm.
So
I figure, yeah.
At the time of
I'm picking up.
Now they were sentenced to death by burning. And so the judge said that if you share with us your secret that prevents the plague, we won't burn you. And they did. And the thieves told the judge their secret, and that they were perfume and spice merchants who were unemployed due to the closure of the seaports due to the plague. They had prepared an essential oil recipe that, when applied to their hands, ears, and temples, feet, and other areas of their body, masks over their mouths included, kept them safe from the infection of the plague. The judge stayed true to his word, and the men were not burned alive, but instead they were hanged the next day by their crimes, and the information was stolen. And the people that have the thieves' oil recipe became millionaires and saved the lives of humanity. And guess what? We have that recipe. We've developed it today, not only to contain the same essential oils as the thieves' oil, but to also include the essential oils that we've determined that COVID-D is receptive to. In other words, would be killed by. And that includes the original recipe plus others. And these essential oils, for those listening that are homeopathic scientists: rosemary oil, lavender oil, lemon oil, cypress oil, myrrh oil, frankincense oil, birch, star anise, juniper, and there is descriptions on how to use this. These essential oils are so concentrated that you cannot ingest them. They're not medicine to take into your mouth. They are only oils to apply to the body and surfaces that will eliminate all viruses and protect you from ingesting the viruses. So they're that intense that this is not something you want to ingest.
So let me ask you a question.
Go ahead.
Because
you remember the quackery.
Let me ask you a question.
But first, do you remember this suit here?
Right.
Do you see this picture of the guy with the chicken mouth and that mask?
Mm-hmm.
The
no, that was the plague doctors.
The plague doctors wore this mask because in this beak they had stuffed rags filled with the essence of this oil so that they could breathe it in while they were treating the patients. And these doctors were eventually called quacks, when in reality 98% of the doctors that wore this uniform survived the plague. And that is something that modern science has disregarded because they cannot understand it.
So let me ask you a question, because I'm relatively new to the homeopathic world. All right. I believe in antioxidants and anti-aging regimes, and so I understand it from that perspective. But this essential oil thing is relatively new to me. Now, when someone applies it on their skin, we can absorb compounds, and it can get into our bloodstream. So what exactly is what is the mechanism here?
It's not that. So the thieves' oil is so concentrated that it's actually antiviral. So that it's equivalent to isopropyl or ethanol alcohol. So that when you apply it, the thieves' oil.
Okay, now the question
listen, stop talking.
Yeah, but
the thieves' oil does one thing different than isopropyl alcohol. Isopropyl alcohol will kill the virus initially if it's exposed for 1 minute. But after that, it evaporates, and then it breaks down within an hour. So by the second hour, the area you treated with the alcohol is no longer treated with anything. The thieves' oil is different. If you apply this to your hands, feet, and face, you apply it to the face mask you're breathing in on, the thieves' oil is active forever. It does not break down like isopropyl alcohol or other things that contain the contaminant due to evaporation. The thieves' oil keeps the antiviral agents contained in an antioxidant environment until it hits the air. So it lasts for hours and hours and hours until reapplication. The thieves' oil we're preparing is only good for 5 to 7 months, and the antioxidant properties break down. So you have to reapply it daily or bi-daily to keep the same effect up. Whereas if you're using isopropyl alcohol,
it seems to me that the essential...
Listen, if you use isopropyl alcohol or Lysol, you have to keep applying it and keep spraying it and keep wiping down stuff. The thieves' oil on the human body lasts for days. So that's the difference.
Okay.
You can have a preventative that lasts or something that's fleeting.
Okay. So it seems as though the essential oils have some sort of fatty acid chain that has a very high evaporation temperature, and therefore it stays on the body, while these other alcohols have a low evaporation temperature, and therefore it evaporates off the body. So it's really it's using some sort of fatty acid or some sort of fatty acid chain. All right, so it stays on the body and it prevents the virus. But how's it preventing it from getting into your eye or your ears or your nose or your mouth? Because that's the entry point. So you're saying that you have to have a mask and you have to have goggles.
No, not at all. And this is why homeopathic and ancient medicine is more important than anything we know today. And it comes from the simple fact that we don't ever move it forward. So if you look at the decoction of this essential oil, some of the ingredients are absolutely toxic. So if we were to actually decoct it and ingest it, like in a dilute form,
Mm-hmm.
it would kill everyone.
Mm-hmm.
So that it's not for ingestion whatsoever. But if we were to make a decoction or a preparation of this essential oil and rub it on our above our eyes, behind our ears, on our feet and our hands, places we touch that are going to get most infected by the virus, they're going to kill the virus on sight. Not only that, there are ingredients within the product that I've researched, like cinnamon oil and other oils, that actually will subdermally intricate themselves into the bloodstream at a low level. So we're talking homeopathic inserts into the bloodstream of cinnamon oil, which is the most antiviral known substance naturally occurring on the planet. So if we're talking cinnamon bark, if we can get a tiny bit of that into our bloodstream, can you imagine what that would be doing to the virus? It's killing it on sight. So I think it's a small subdermal drain into the veins and that we've kept out of our mouth from ingestion that's actually like a receptor. So if I'm a perfume guy and I rub all this shit all over my body all day, I smell like patchouli and I'm running around
Mm-hmm.
selling my wares,
Mm-hmm.
it's flowing through my blood, correct? So the cinnamon and the clove oil
Mm-hmm.
is flowing through their blood. It's preventing the pathogen from ever, attaching. And I think that's the key. The key is the essential oil from the outside makes its way inside, and it makes everyone safe. And this is just ongoing research. Homeopathy has been considered quackery for decades, and I believe that it's bullshit. That the powers that be do not want us to know how to heal ourselves, and plant-based medicine is everything, Paul. And I'm pretty sure you're on page with what I'm saying.
No, I'm learning as I'm going with this. I was coming from more of a medical, traditional medical background on, how to deal with this stuff. But as I'm diving in more and more and noticing that the medical, the medical structure, institutions may collapse in the United States in the near future, other remedies have to be looked at. To me, it seems rational on this thieves' oil concept. You can just take you can take it the other way. If you use perfume or cologne, it does disrupt the endocrine system. So people should not use perfume and cologne. You just for homeostasis, for proper health. But on the other side of the spectrum, it makes sense to have some sort of oils. We'll call them essential oils, but these essential oils being able to disrupt pathogenic processes. So it makes sense topically that it's a long-term disinfectant. Totally makes sense to me. And it makes sense to me that there is some sort of absorption into the body at a low dose level that disrupts the viral multiplication in the body.
Yeah, you froze up. That's why we're
Break
saying,
down. We're gonna
we're,
as our medical system starts to break down, we're gonna need these types of things. So
yeah,
I mean,
and
I'm
so
I'm learning as I'm going, Diamond,
yeah,
and you taught me something today because I didn't know about this.
I know, and that's how we work. We all feed off of each other, unless you feed me shit that I don't believe in, and then we're done. But you and I are a different hog in the whole metaphysical world because you and I work on science. So there's no way I could never agree eye to eye. And that's what I want to get out to the public, that there are true scientists that are working on solutions and information, and we're basing our proxy on known information. We're vetting it with the future, and we're coming up with new hypotheses. We are not conspiracy theorists whatsoever. So the demonetization of our platforms is completely ridiculous because, and what I told Paul earlier was the information that we share with you is literally 48 hours ahead of the game. So anything that's on the mainstream that we talk about is not fake. It's exactly what they will say 2 days from now. And my supporters, and I'm sure yours, like they email us 2 days later, the same stuff we talked about 2 days ago. And you're just like, oh my God, this is the problem. People cannot get this information in time to protect themselves. And once they do,
Hmm.
there's no more N95 masks to get. There's no more essential oils. So the thieves' oils to protect your family has been well known from colds and flus in the homeschooling environment. And that's why people that live in regions where I do, we don't get sick. I asked Leah the other day, I was like, look, this guy's sick, Rex is sick, people are sick, what's going on? And she said, well, you and I haven't been sick in 8 years. And
Right.
because we know we've been taking these decoctions since we left. And when I met Leah, I said, look, we have to have some certain micronutrients. We have to grow our own food. We have to eat these products, and then we'll never get sick. And she didn't believe it. And now here we are, like 8 years later, and we've never been sick. Everyone around us is sick. People with kids at schools get sick. We do. I haven't been sick. I haven't been sick in 8 years. When we get sick, we're like
So
we're under we're
let
under
me
the
ask you a
weather for
question.
a few hours, but then we recover, and that's because our
All right.
immune system is bolstered by these products.
So let me ask you a question. In terms of getting a cold or some sort of viral infection, which is yeah, but which essential or see, here's here is the complicated issue for people, even with myself, because I'm relatively new to the essential oil world. What does one get? What exactly do they buy? I mean, I understand, I purchased a bunch of inhibitor nutraceutical type stuff based on a research paper, and I bought five of them,
Paul,
including the
Paul,
licorice root. Yeah,
Paul, I think
yeah, yeah.
that the essential oil market is overrated. I think a lot of people are paying too much money to be healthy in the essential oil market. But the essential oil market has its place um, to prevent viruses, to help with short-term cures for cold and other things that come up, and to help with blood
Mhm.
pressure and other ailments. So that marketplace is already set. And the reason Leah and I are healthy is not because of essential oils. It's not because of nutraceuticals, but it may be because the food we eat, it contained nutraceuticals. So when we changed our lifestyle, when we changed our way of life, we were re-exposed to new pollen. We got new allergies. We got sick as soon as we got here.
Mhm.
But as soon as we got here, we continued to eat fully organic, grow our own food, micronutrient central. So what we've been doing is not only growing our own food with no chemicals or sprays and eating that, which contains more micronutrients than any food available in the supermarket. But we've also been pre-purchasing green food solutions. So you can get a green powder that contains organically 100 micronutrients that you need daily to fight off all disease. You'll never get sick. You'll never go hungry, etc. But many people are priced out from this. We're talking it's cost $50 a month to get a good green organic powder that you can eat every day. So you're talking about $1 a day to get a dosage of the micronutrients you need to bring your immune system into homeostasis that could fight off everything, plague, coronavirus, etc. All these diseases are fake names to scare you. If you're impenetrable to all disease, Paul, what would you have to worry about? Nothing. And people outside of this blogosphere, this video, they have no idea that the food they eat is getting them sick. They can only afford the cheap food that's
Hmm.
processed in the center of the supermarket. It's filled with pesticide. It's killing them. All they have to do is stop spending their money on food and start spending that money on seed, grow their own food inside and outside, and they can survive and thrive for the rest of their lives. There's no need for medical insurance. This is created by the same people that
Yeah,
created the
but
food that you fucking eat. I'm sick of it.
yeah, but here's the problem. With me being in New York
Yeah.
in my 800 square foot place, I can't grow a garden in my living room.
Well,
You
you
know, so
decided to fucking live there, and I decided to live in Philly, and I decided when I was fucking 45 to get out. So it's your fucking problem that you're stuck in that shithole with a bunch of infected assholes that don't know how to eat food. So you're literally stuck
right.
in a city surrounded by infectious assholes making you sick. If you lived in a community where everyone ate organically and they were impenetrable to virus, how do you think your future would be? I mean, this is a question everyone should ask. Why do I live in an area where they promote vaccines and they have medicine for infectious disease when there are areas on Earth that no one is sick? People live to their ultimate destiny, 90, 100 plus, and no one dies from cancer or other fake diseases created by the food we eat. So answer me these questions. I mean, you just come onto the scene when a virus takes place and you don't want to answer the bigger questions. The reason our population is going to be taken out by this manufactured biological entity is because they don't know what nutrition is. You know, I'm 50 years old, and I was taught in school about the food pyramid and all the bullshit and how I have to eat carbohydrates and this and that and the other. That is nonsense that comes out from a corporation paid by another corporation that
Mhm.
genetically modified organisms that are now growing food for your schools. These are not the people we want to follow. You want to follow people like Paul Cottrell and I who want to teach you the olden ways, the ways to grow food, survive and thrive, to get off the grid, to stop buying into the algorithm. I mean, can you imagine? AI is listening to Paul and I, and they're figuring out a way to take us out so you can all eat the Soylent Green. Period.
Yeah, I agree. I agree. Unfortunately, I can only work with what I got at this moment in time, and I'm in the middle. I'm potentially in the middle of an outbreak. So, if someone is to use the essential oils as a means to reduce infection from this outbreak, what do they get? What specifically are they getting? On that list that you were showing that
Yeah. So
is on my website also.
yeah, if
But
you so
what combination of essential oils should one get?
the thieves oils that we've created that tomorrow night supposedly in Bluff, Utah, because I just talked to Todd Kleckner at 9 Reese. He's mixing this decoction, which he's probably the most qualified to do it in the country that I know. So I trust him wholeheartedly. So he started with the Thieves Oil blend, which he knew it costs the cheapest you can get it is about $40 an ounce worldwide. So he said if I buy a big enough of the Thieves Oil blend in bulk, I can add my additional ingredients and still break out even. And we'll talk about that tomorrow night. But the Thieves Oil is only a preventative, Paul. So it's not, I
Right,
think that
right, right.
everyone out there should be buying isopropyl alcohol for wiping down. But the Thieves Oil replaces that uh, antiviral wipe down because in the recent studies of what thieves oil actually did and why those people survived, it suggests They had a small amount of diluted thieves oil with apple cider vinegar, which is basically a dollar a pint, or white vinegar, and you wipe down everything. You can kill the viruses faster than an alcohol decoction. So these are extremely antiviral. So with just a small amount, for every drop, you can make a gallon of the most antiviral wipe. And also you want to soak your masks and wipe your body and feet with this and clean your hands. But this is the ultimate, original antimicrobial. It's not that garbage ethanol shit that's called whatever that you buy from Purell. This is the real deal that worked in 1400 to protect from an actual plague virus. And the COVID-19 pales in comparison to plague, in my opinion. But it's similar because the death rate is very high. Currently, it's almost the RH naught is between 6 and 8. Changes every day based on the paper. But I think that prevention is 100% to survival here. Prevention. It's easy to catch, but if it's not around, how can you catch it?
Now, these essential oils, let's say the oregano oil, how do they make the actual oil? I mean, okay, so you're growing oregano, but what do you, all right, and you trim the oregano. So what do you do? How do they make the oil?
What we do for essential oil manufacture is we will harvest like 1 or 2 pounds of oregano, and we stuff it into this hyperbolic chamber. We add a little bit of water, and we put it into something that's called a still, which is how you make alcohol. And this still, you create pressure in the hyperbaric chamber that takes the oil into steam and moves it up through the system, where the oil drips out into the decoction and the other contaminants move out into the air. It's been going on for hundreds of years. It's what Prohibition was based on. But this is basically an essential oil machine is a way to make alcohol. So you make alcohol out of the plant material and you get the essential oil, which is a pure oil of the plant decocted from the leaf, which would be what you're looking for if you're making a pure oil of the grain, and you would get grain alcohol. So in this sense, we get grain or oregano alcohol when we're making a decoction of oregano. If we put wheat into the hyperbaric chamber, we would get a decoction of wheat and we get grain alcohol. But when you use oregano, you get grain oregano alcohol.
I see.
And then that is.
I see. So it's the vapor. It's the collected vapor, and then it's condensed into a liquid.
And that's
the actual oil.
Yeah,
is the actual oil.
Yeah,
not what's left in the flask.
That's why these essential oils are so expensive, because there can be based on the process chemically, there can be no contaminants in the final product. It has to be the final product. All oregano oil, all this oil, all that oil. So the essential oil gets decocted from the process in a clean state where there's no contaminant. It's actually beautifully chemical.
I get it. I understand. Like in the organic chemistry lab, we did this sort of thing to purify chemicals.
Yeah, and you just need some copper tubes and some heat, and you're golden.
Yeah. And what's interesting is that because there's different substances in this, that if you have a large enough condenser column, you'd be able to collect different chemicals based on the actual vapor pressures of each of the chemical. Yeah, but interesting. Very, very interesting. I mean, it's a different way of looking at the problem. It's something that I never really thought of, because I always thought that the essential oil market was just kind of hokey, but I never really looked into it. I just had this, just knee-jerk reaction that it was a hokey thing. But There's something to it. There is something to it here.
Oh shit. Yeah, there is indeed. And someone just called me. So, Paul, we're going to close up this podcast tonight on thieves oil. Protect your family from colds and flu. It's been a known
Okay.
process for 500 years. And I've just gotten you to turn table and say, maybe there's something to it. But we are reporting on the facts that there is something to the coronavirus, which is now COVID-19. Uh, there's a new way to diagnose it, and we're following the new numbers. We only have now, we're at 36 hours of the new numbers. So I'm really interested to see how these will progress. And if you can see this now, the John Hopkins went from a 33% jump, and they added another 20% jump, and we're now at a ridiculous amount of almost 65,000. So it's I believe that in the next week this is going to quiet down in these regions because they have a containment, but there will be a secondary burst worldwide and people are going to be scared. So don't be scared, be prepared. There are multiple levels of preparedness. If you don't have masks, don't worry. Surgical masks are useless in the prevention from getting this disease. It's a fake thought. They serve no purpose. If you do not have an N95 mask, the only thing you're doing is preventing you from coughing the disease on other people. The surgical masks are for people with the disease to prevent the spread. If you have an N95 mask that's molded around your face, and I can't even show this, it has to cut every part. If you breathe in an actual N95 for over an hour, you will be so pissed off you're alive, you won't even know where to go. And I've used these masks in construction for decades in toxic areas. They're horrible. You won't even want to live in one. So I don't know why people think this is a solution. Masks are not a solution. The solution is to beat this disease before it gets you. Essential oils, micronutrients, immune system bolstering, stay away from infected people. If you're a healthcare worker, we're praying for you. You have a 1 in 3 chance of getting this disease, and you're on the forefront. If there's anyone that deserves a Purple Heart, it's the healthcare workers on the front lines of this disease. I don't care about any military person at this point. If you are working on this disease and you're on the front line, you deserve a Purple Heart, and my phone is going beep, beep, beep. Paul, let's close up the interview with positive messages for people listening.
Yeah, just be prepared and and get educated and boost that immune system. That's going to be your best chance of coming out of this with a good outcome.
Yeah, and the worst chance is you're where Paul is, in a major city, and you're just learning about essential oils and believing in the words we're saying. Paul, I'm going to send you out an ounce of this as soon as I get it. It's coming in the mail in about 3 days. The first decoction of this material is coming to us. I'll send it to you, and we're going to offer this to the public
great.
tomorrow while we're on the trip in Bluff, Utah. And my friend in New Mexico only mixed up 169 ounces of this. So that's all that there's available. It's about $38 an ounce based on his wholesale cost. No one can get this decoction for less than that worldwide. If you were trying to buy thieves oil right now, it's going to be about $40 for a half an ounce. So you can get a whole ounce with the additional nutraceuticals that Todd Kleckner decided should go in based on this virus to keep your family healthy and safe. And we're going to be revealing that tomorrow night on the podcast. Paul, I'm going to send you some. Tell me how it's working out for you. I'm glad you came on the show. Anything else you want to share with the people other than we're in the waiting period for this to blossom worldwide?
Well, I mean, I'm going to be going on, I'm going to be going on Doug Hagman's show on Monday. So I believe it's at 12 o'clock, and it's a live show. So I'll send out an APB on my channel saying that, going live on his show, but hopefully you can listen to it or you can listen to the recording. And I'm just trying to spread the word on these different channels, radio shows, and podcasts to just help people. So we got to band together.
Yeah, we can't, Paul. We can't thank you enough. You're a hero amongst heroes. You're becoming a legend. And can we announce to the public about what may happen on April 4th?
Yeah, yeah. Well, I mean, I'll go. I'll be at this LeakCon conference, and hopefully I'll get to meet some people that have been fans, and we'll discuss what's going on with this whole crisis in the United States and the worldwide. But hopefully everybody's safe. That's the key point. But I'll be there. I'll be there.
Yeah, we're all crossing our fingers, and Paul Cottrell will be at LeakCon 2020 in Boulder. He's going to be staying with us, so it's going to be an awesome time. We're going to get to meet each other. We're going to have a great time, and hopefully things don't blossom where you guys can't come out to see us. But we hope everyone out there is listening will come and survive and thrive in Boulder at LeakCon 2020. Paul, it's been a pleasure, and we'll talk to you soon. We love you. Be safe.
Okay. All right. Thank you.